Hello everyone, this is a little video to help people understand the consultation process that you'll have if you're talking with us about lipo. Now, there are another series of videos that talk about breast implants, and much of the process of going through in terms of the consents, the understanding of the facility, it's exactly the same. So we'd encourage you to go through that. Now, the consultations will be done. We do them face-to-face, that's obviously the best, but we can do these over the phone by Skype. Now, we will need you to send us some photos, and the most important thing is for you to mark on your body what is the area that concerned you. We suggest you use either different colors or number them. So if your tummy is a concern, mark up what to you is a stomach. Does that go to the love handles, to the side? So we can then, okay, well, this is the price for that area for you, and adjusting if there's furthers. Conceptually, with liposuction, you have to think, okay, how do you get rid of that fat? Well, what we're going to do is we're going to use a method that has been around for years, developed by Jeffrey Klein, called tumescent anesthetic. Now, we're going to numb the tissue, and that tissue is going to allow us then to do the procedure, but also break the fat down. Think of a block of cheese. Put a straw in it, pull it back out, now you have a hole in it. Make multiple holes, you've made the hard block of cheddar into a Swiss cheese. It's got less holes, less structurally sound, but doesn't get a different shape. Make a fluid go into the cheese, make it a camembert cheese, suck out the substance. The cheese now squashes down and stays down, especially if you put a weight on to compress it down. So liposuction involves those multiple holes numbing the areas. Two holes next to each other. You want to go and get that fat in between. If there's nothing behind, the fat will not be able to be got. That means there's a limitation to the liposuction. You then squash it down. You squash holes, not fat. That fat that's left can form the limit, but also can form lumps, bumps. And if you have the holes and you bleed or bruise into them, those small hematomas can form lumps and bumps. Holes open in the center form down grooves. Now, the machinery we use vibrates and breaks fat down as well as suctioning, so we can always leave loose fat in there. By massage and movement, you can get that fat to smooth out. Now, we have to tell you the risk particular for you. So we need to know those health details. We need to know if you're a person that's a suitable candidate. Liposuction is not weight reduction. Liposuction is shape change. You will always have to deal with issues of laxity of skin on the outside. Blow a balloon up, leave the balloon there for a long period of time, let it down, the surface can be loose. If you have a large amount, it's a greater risk. If you're older, it's a greater risk. If you're male, it's a greater risk. Females, younger, smaller amount, lesser risk. We know that the skin has layers. Underneath the surface of the skin, if you go and you have a wavy dermal layer, you have a tight upper surface. If you have a flat dermal layer, you have a wavy upper surface. So we go in the procedure, tighten the dermal surface so that it tightens up the skin. We encourage you to do mechanical massage. You should also be thinking that if you have loose skin, you might need other ways to help reduce that. You might need mechanical changes, you might need energy sources with ultrasound or radio frequency. So always allow for those. And in particular areas of skin, lower arms or legs, if the skin is too loose, you might need a surgery. One of the surgeries to take out the skin. Significant scarring and changes, so again, you have to be aware of it, that's there. So we take you through the guidance of what to expect. Liposuction is time-based. We numb the area, we then go and take the fat out as best we can with the limits we described. We'll change your body, do another area, change your body. You can't expect to fall asleep and wake up. We'll give you medication that will numb you. If you require more medication, we will give you more medication. The medication has a weight-safety ratio. So you take the weight, multiply by that, say that's the amount of medication you have. Think of a bag of fertilizer. You can put it on your front lawn and leave the back lawn. You can spread it on front and back. You'll get a lesser effect, but you'll go for more, or you can concentrate. So we can concentrate, make it more comfortable, or we can spread it out. The price is based on the amount of time we have to spend it and the difficulty. Men are harder than women, redos are harder than first times, but again, we price it such that if you've come in and you've had your liposuction with us and you come back and go, look, I just want more off, we will work very hard to decrease that price. It's usually about half to a third. Lumps and bumps, we just fire the theatre up. We don't have to do it often, it's less than about 1 to 2%. We'll go in and smooth anything out from that side. But again, always understand that a perfectly shrunk body maybe not possible. There will be small holes, usually about 4 to 5 millimeters, hidden as much as possible, but sometimes it will occasionally dark. All these risks are explained in the consent process, and much of the surgical risk is the same as in the breast videos. Particular risks of liposuction, as we said, not enough lumps and bumps or laxity of the skin, and we'll take you through those, and you particularly from that side. So I hope this brief video gives you an idea of the consultation process. It usually takes about 20 to 30 minutes. A lot of it is explaining what's possible for you, and again, we can do these over the phone with pictures or Skype, so take the time to draw up properly from that way, measure yourself as well too. You will shrink in size, you probably change in the clothes side as well, and liposuction is a very good process to change that fat that just won't move. If you have all fat and you've just got bigger, it's not for you. If some areas are maintained, the body has a homeostasis and tries to have every fat cell at the same level, and some fat cells can expand. It's genetically programmed. So if you're that person with a stomach that won't change, the love handles, the thighs, the legs, we can help you. So give us a call. So I hope that's helpful. Bye.